This week has been all about managing withdrawal. In this week, you increased your understanding of the biology of addiction by looking at the processes underlying the withdrawal syndrome experienced. You reviewed the nature of withdrawal signs and symptoms associated with different drugs and general principles for managing withdrawal. Withdrawal symptoms are the result of adaptations to the constant presence of drugs, so they are often the opposite of the drug effects. Symptom relief and management of potentially dangerous symptoms are an important part of managed withdrawal. We discussed realistic expectations of withdrawal, given that withdrawal only addresses the physical aspect of dependence, and we highlighted the diverse reasons that people may have for undergoing managed withdrawal. We also talked about the need to make haste slowly. No matter how desperate people are to sort their lives out, attempting too much during withdrawal is a recipe for failure. Managed withdrawal is just that, management of the symptoms of withdrawal. The psychological components of dependence need to be addressed after the symptoms have subsided. It is important to provide support during withdrawal, but this should be practical in nature. Medication to relieve symptoms, a safe and comfortable setting, links to services for accommodation and welfare needs, and most importantly, the development of an aftercare plan to support engagement in ongoing treatment. We followed our case study Eddie to an inpatient withdrawal facility. Eddie had been drinking large amounts of alcohol every day for 6 months and was likely to experience withdrawal. This made it important to plan his withdrawal and evaluate the possible risks such as hallucinations and seizures. So we discussed some of the issues that would be considered in the clinic when developing a plan to help Eddie deal with alcohol dependence and the associated life problems he has accumulated. In the next week, we will travel further along the recovery pathway and look at how different types of psychosocial support can be used in combination with medications to support recovery.